I'm Dr. Carol Henricks. I'm a neurologist specialist. I have a neurology practice and I have a treatment center beside my practice. I work in the community in Tucson, Arizona. I've done a lot of work over the past 14 years with military veterans with TBI, PTSD conditions. And my work is primarily on healing the brain injury. And all of my slides are on Google Slides. They're going to be on my website at patriotclinicmovement.org. And the slides will be there along with my notes and some typed references for what I'm telling you today. So the prevailing opinion in traditional medicine is that you cannot be healed from a brain injury condition. And brain injury conditions are things like concussion or the downstream effect of concussion, Alzheimer's, Parkinson's, ALS, mixed combined disorders. But the question is, who told you that? Why do we believe that you cannot heal from a brain injury condition? Is it because we didn't learn that in medical school? Is it because there's no pill for that? Is there any reason that we think that there's something different or special about a brain cell, a neuron, that it should not be able to heal when other tissue in the body can heal? So who told you that? Who told you that you can't heal? Most of my work has been with military veterans with the traumatic brain injury that they have, but the traumatic brain injury that veterans have is much different than the brain injury that civilians have because of the exposure that our veterans have had. So we're talking about blast injury, lots and lots of blast injury, because every time you fire a gun, that's a blast injury. An IED is a blast injury. The rockets are a blast injury. And if you had just one of those injuries, it would likely be inconsequential, but our veterans have had hundreds of these kind of injuries. So when something explodes, the blast wave comes against the body of the veteran, and so that develops a force. So that's a concussive force. And the veterans, when you talk to them, they say it's like a blast wall comes against you, followed by a vacuum, like all the air is being sucked out of your lungs. So what is it really? What kind of injury is it when you have a lot of pressure against your whole body and then there's a vacuum? Well, that's really like the bends. You know, that's like being deep under the water and then being brought to the surface too quickly. So there's at least two mechanisms of injury that a veteran has from being exposed to a blast. And then my chiropractor friends and colleagues talk about the stretching from the brain itself through to the brain stem. So you're stretching what are mostly the long motor neurons, and therefore creating a separate source of injury for them. But of course, injury exposure is not just the blast, it's from the toxic exposure from the munitions that are used in war. So we're really looking at arsenic, lead, mercury, and cadmium as toxic exposures, and part of the injury cycle with the neuroinflammation, there's a part where a lot of calcium goes into the cells and causes destruction. But in people that have a lot of this heavy metal exposure, all the heavy metals go into the cells and create a separate source of toxicity. We have the exposure to drugs like the malaria drug, which Lariam, mefloquine, which causes anxiety and depression and can cause hallucinations. We have exposure to the vaccines and the adjuvants. We have disruption of the endocrine system, the hypothalamic pituitary axis, which if you open your mouth, and I'm thinking of all the veterans I've dealt with that are door breachers, and they tell them to open their mouth and turn their head, But if you go deep, open your mouth and go deep, right up behind that is your hypothalamic pituitary axis. And that's part of your brain is in charge of your whole endocrine system. So if you mess up your thyroid function and mess up your testosterone, you definitely affect your cognitive abilities. Of course, there's infectious disease, change of intestinal fauna and flora, and nutritional loss that goes along with being a deployed veteran. So all of these things impact brain health and impact the injury that the veteran experiences and their ability to recover. The interesting thing is when you look on the internet to try to get a sense of how much injury exists, is there's a very different picture painted by the VA than by all the separate groups that are advocating for veterans. The VA suggests that there's maybe some people with a minor injury, and the other websites for veterans suggest that 84% of the veterans are seriously affected by these things. When you experience a concussion injury, obviously there's degrees of concussion. A minor concussion, you would have a biochemical change in and around the brain. A more significant concussion, you have the shear injury to the neurons and the stretching effect. And any injury to a neuron that doesn't heal can then lead to something called Wallerian degeneration, which is future cell death, because if the neuron doesn't heal, then it starts dying back from that point. And more serious concussions, of course, there's intracranial bleeding, there's catastrophic head injury where you've fractured your skull and you have a lot of blood or an intracranial bleed of some kind. The brain injuries I am mostly talking about are the accumulation of subclinical concussion injuries. So the soldier or the NFL player or the athlete might not even know that they've been injured, but they just have this accumulation of concussion after concussion, and some doctors call them subconcussions. But there really truly is a damaging effect of this accumulation of injuries. So why don't the people that have the concussions know that they've had a concussion? Well, part of the problem is the brain imaging that's continued to be used by the traditional system. The NFL players and the military veterans and people who have been injured, they're given a head CT scan or a routine MRI, and even with contrast, it does not show the injury from concussion. Being able to see an injury depends on having an appropriate test. And a traditional head CT and MRI is just not an appropriate test. However, what you see on the left image is a routine MRI of an older veteran, somebody that saw a lot of combat, and he's been diagnosed with Alzheimer's dementia. And his wife brought him to me and said, I think he probably had a lot of concussions from being deployed, being active duty in the war for a long time. Can we do a test and see if he actually has had concussion injury? So what you see, the brightly colored lines that you see coming from the corpus callosum. Corpus callosum is right in the middle of the brain. And so what happens is a brain cell starts here, and the brain cell starts here and travels down through the cortex of the brain, crosses over at the corpus callosum, and then reaches up to touch the similar neuron on the other side of the brain. So what you should see should be like a peacock. You should see, this should be filled with colored lines that reach out and cover up all the brown brain matter that you see. But it's very, very disconnected. And so this is the picture of somebody that has had exposure to a lot of concussions, but all they're seeing with the regular MRI is that there's less brain tissue. There's evidence of atrophy. If you don't do the MRI DTI, you don't see that it's from disconnection. That's a major component of disconnection in the brain. So when our young military veterans have a head CT scan or an MRI, they say, well, your brain looks fine. You didn't have any brain injury, so everything that you're experiencing is psychiatric. But where do psychiatric symptoms come from? It all comes from the brain. So, however, if they do not see the brain injury condition, that allows them to justify just giving them psychiatric medication instead of seeing it as a brain injury condition. And this is true in the military, and this is true with the NFL, ex-NFL players. In fact, we haven't identified yet a VA hospital or a military hospital that's using the MRI DTI imaging, even though it's been approved by the FDA for 15 years. Why is nobody using the tools that would allow them to see the injury? Because if they see the injury, then they have to treat it. The other technology that's used to see the brain injury condition is called a brain quality SPECT scan. And that gives you a very detailed colored image of where the brain injury exists. There's actually a Dr. Daniel Amen in California who's a psychiatrist, and all of his patients who came to him with psychiatric symptoms, he did a brain quality SPECT on them. And then when he treats them, he does nutritional things, supplements, and puts them into the hyperbaric chamber. A hyperbaric oxygen chamber is the primary focus of what I use to heal brain injury conditions. A lot of people have never heard of a hyperbaric chamber, but when they have heard of a hyperbaric chamber, they say, oh, isn't that what they use to treat the bends? Or isn't that what they use to treat diabetic foot ulcers? And the answer is yes and yes. Hyperbaric oxygen therapy has been more studied than any medication or any treatment that we use anywhere in medicine. And it therefore should be understood as the tool that it is. It's not a specific treatment for a specific condition. It's just a very powerful tool for healing. So when you're in the hyperbaric chamber, and the most common treatment pressure that's used worldwide for neurologic condition is 1.5 atmospheres, which is 0.5 above ambient pressure. So we're not talking about a tremendous amount of pressure for a chronic neurologic condition. And what it does is it tremendously enhances the oxygen carrying capacity of blood. That's really the only way you can tremendously enhance oxygen carrying capacity that we have available, because remember that each hemoglobin molecule can only carry 8 oxygens. We can't make the hemoglobin molecule carry any more oxygens. The only way to get more oxygen in the blood is to dissolve the oxygen bubbles into the plasma, which is the fluid part of blood. So just like bubbles in soda, you dissolve little oxygen bubbles into that plasma, and you tremendously enhance that oxygen carrying capacity, and it has direct healing effects wherever it goes. When I teach nursing seminars, I say to the students, I say, you have a patient, they've had a stroke and they have a diabetic foot ulcer, and they've had a heart attack. Which problem is the hyperbaric oxygen therapy going to help to heal? And the answer is all of them, because the healing effects go to all tissues. It's not that you could localize the healing effect to only one tissue. So we have the direct oxygen effect on tissue. Then we have the tremendous enhancement of release of stem cells from bone marrow that helps to heal all of these problems. And then we create a hyperoxic environment that creates oxygen radicals. Now, everybody gets very scared when I say oxygen radicals, because we know that oxygen radicals have traditionally been something bad or scary, and it can be a problem in hypoxic or low oxygen tissue. But it turns out that in a hyperoxic state, that those oxygen radicals actually mediate modify gene expression at a DNA level, and they upregulate healing factors and downregulate inflammatory and destructive processes. There's been more than 8,300 genes that have been directly studied and manipulated by the hyperbaric oxygen therapy. Now, once you have the oxygen radicals, the system also upregulates the enzymes that are going to break down the oxygen radicals. So people say, what about the accumulation? There is not, because the enzymes break it down. So that's the way the system is meant to work. Then the other things that hyperbaric oxygen does, it helps to detoxify tissue. It helps to fight infection. And you also have the new blood vessel growth into injured tissue. And this is my 6-person hyperbaric chamber in Tucson, Arizona. And it's a 6-person chamber because when I learned about hyperbaric oxygen therapy in 2003, it clicked with me right away that this was going to be a healing tool for military veterans, and I thought about putting them in the chamber together as a group. So if you're talking about brain healing, of course, your brain is a very finely tuned instrument, and you can't expect to just blast oxygen in there and have somebody all better and everything about their personality and motor skills and everything works perfectly. But everybody is an individual, so what happens is I do an initial evaluation to see what kind of problems the patient is having. I work with a neuropharmacologist that will then recommend a nutrient optimization program for that patient, and particularly if they also need to be detoxed, they do the hyperbaric, and they might do cognitive therapy, acupuncture, ionic foot baths, neurobiofeedback, pulsed electromagnetic field. There's many therapies we bring together to maximize their healing. The whole purpose of everything we're doing and trying to bring together is to create something called Patriot clinics. Patriot clinics, we believe, would come alongside the VA hospital and offer alternatives to veterans who are not being helped by the traditional treatments. Traditional treatment being the medication, and we know that the medication they're giving these guys all has black box suicide warnings on it, and particularly for younger people, which is the group of people that we're talking about, there is data out there that says 100% or nearly 100% of homeless veterans have traumatic brain injury, PTSD spectrum conditions. Now, is TBI and PTSD truly different things? If you look at the group of PTSD symptoms, they're really a subgroup of traumatic brain injury symptoms. However, they've been diagnosed with PTSD because when they do the standard MRI and the standard head CT scan, they don't see any injury. So they say, oh, it's all psychological. You must have been psychologically ill before you went into the service.
My name's Clint Chamberlain, formerly a sergeant in the United States military with the 75th Ranger Regiment, serving with the 2nd Ranger Battalion for 5 years and 6 months of my career. I think I've been knocked unconscious maybe 3 times my entire life. I was never diagnosed with a concussion. I was checked by the medic, of course, out there doing our training exercise. If you picture your brain and your brainstem is a flower, right, and you shake that thing, it's very fragile inside that skull. I don't care how much padding you put on it, it doesn't protect your brain. It just protects the skull, your carrier. It's an accumulative effect. So whether it's rattling your head one day and then you get a week off or another week off, and you go out doing your job and you're knocking on doors, blowing them in. I mean, we all know that you get 6 feet standoff from some of those breaches, and that's all you have to work with, but it's necessary. It's necessary to get that job done. It's necessary to have that violence of action and get in that room as safely as possible so you can do your job.
Roger that.
And they're suffering major life-altering effects. For instance, you can't put a plan together. You can't make your life come together no matter how hard you try. Your spouses start noticing the difference usually first because can burst into a rage in an instant over something that normally would have never affected you, but all of a sudden you're ready to rip the walls off. These are all things I've lived with, man. It completely dismantled my life. Look at our suicide rates alone. It's just disgusting that this is been put off and blocked by the FDA and special interests out there trying to keep pharmaceuticals pumping through our vets, and it's stealing them from their families. It's stealing their life away from them, making them shadows of their former selves. And I speak from experience. My first experience with the VA was of course after ATS from the military. I was having problems in my relationship and holding my life together. I couldn't even formulate a plan before I got out of the military. I couldn't pick a hole and stick to it. You know what I mean? Mm-hmm. I didn't have a career path. I couldn't even think about what my next goal was going to be, or even have a dream of accomplishing anything greater. And I couldn't figure out why. I couldn't figure out why I hated myself so much, why I had such self-loathing, and started to develop these very suicidal thoughts, even if everything could have been perfect as can be, and I would still just want to step in front of a bus, man.
And especially guys that were in the spec ops community. I mean, we were basically the pinnacle of success in the U.S. military. I mean, we took it all the way. So why would we go from being the best at something to wanting to end our lives, or not knowing what the next step is?
You know, myself included, when we get out of the military, you think, you know, while I was in the military, I was successful at this, and this, and I did this, and this, and that's what I was capable of. And now we're out of the military, and all of a sudden, what's left?
I couldn't see the things that other people see in me and would comment on, whether it was my ability to fix things or my ability to communicate with them. I didn't really see myself as any type of valued asset, and I started formulating a plan to take my own life. Through what I know and my abilities to craft and design things, I came up with a pretty awful plan, and I won't share that part of it because I don't want anybody else out there getting any stupid ideas, because it's not worth it, and they are... Every person out there in that deep, dark hole right now is worth the effort to try and get them the help they need. And it's hard for me to say that out loud, but I'm here to bare my soul, man. I'm not pulling any punches. I got nothing to hide, and I don't care anymore. It's time to get this message out there and save some more lives. So an old Ranger buddy of mine, so I just threw a message out there, and I plainly said, "I love you, brother." And that was it. And next thing I know, I'm getting a flood of text messages and phone calls from all sorts of old former coworkers and guys I haven't even met, and show up at my front door after driving 4 hours through a blizzard, and with a plane ticket for me to come down to Phoenix, Arizona. I'm over here in Tucson, Arizona at North Star Hyperbaric and neurology, working with Dr. Carol Henricks. She's an amazing person. She's going to be a lifelong friend forever. Nice. She definitely one of my best friends. She's, along with a lot of other people out there, saved my life. They got me into that chamber as soon as they could, and within 10 days, I noticed a massive difference in my disposition and my ability to function and think and maintain a positive attitude. Really kind of unbelievable and surreal at this point, because I'm 50 treatments into the hyperbarics, and I feel like my old self again before any of those experiences. Like I said, more so than I have in a decade.
That's what's up.
It's just amazing. It took a lot of people to get me here, and I have an overwhelming amount of gratitude, and all I really want to do is say thank you. And I love all of you, and I just want to pay this forward to show my gratitude.
Clint was an Army Ranger veteran. He had 12 deployments, and he was a dramatically different person after his treatment. I include his testimonial because he is so articulate in talking about the changes, but this is what I hear from all of the veterans. This is the norm in terms of their experience of healing and recovery.
Hi everyone. I'm retired United States Air Force Technical Sergeant Robin O'Bannon of Chandler, Arizona. When I entered the United States Air Force in 1987, it seemed like a good idea. When I deployed to Saudi Arabia for Desert Shield, Desert Storm, and Southern Watch in 1990, 91, and 92, I learned firsthand that heroes are just ordinary people under extraordinary circumstances. And when I re-enlisted, I knew that service was a calling for the rest of my life. You cut me, I bleed Air Force blue, and my plan was to stay at least 26 years in the Air Force. I was able to serve in so many different capacities: a dental technician, a patient decontamination specialist in wartime, a singer, a member of the Honor Guard, a drummer and drum captain of the Drum and Bugle Corps in basic training, a recruiter, and that's a short list of the opportunities that I had to share my talents in the United States Air Force. And that's why it was a devastating blow when in an early fall morning in 2004, I got up to go for a run with my airmen, and I collapsed on the floor next to my bed, and I was never the same. I went to doctor after doctor being treated for everything from vertigo and insomnia to depression and weight gain. And my hair was coming out in my hands in handfuls. The fatigue was terrible. The pain in my body was terrible. But since my tests kept coming back within normal limits, I got sent to a psychiatrist. My tests did finally come back abnormal, or some of them did, and I was diagnosed with fibromyalgia and lupus, among other things, finding out that many Gulf War veterans had been diagnosed with these illnesses. I was actually retired after 18 years, permanently, from the United States Air Force. Whenever I try to explain it to someone who's never had what I've had, I liken it to having a flu every day. And I've had the flu every day for the last 12 years. I've had to use wheelchairs and canes, and even for a period of time I had a home health care provider who assisted me in bathing and taking care of basic household tasks. And I had a drug cocktail that defied logic. Modafinil, testosterone, Xanax, Vicodin, you name it. The street value of the medications I was taking was probably pretty hefty. But I was still moving further and further away from the center of health, and it made no sense. Skin on some parts of my body was turning black. I wore sunglasses, sometimes indoors, because chronic headaches made me so sensitive to light. The palms of my hands and soles of my feet were waxy yellow-gray instead of healthy pink, and the fatigue was so crippling. I had to choose sometimes between eating and going to the bathroom, because I didn't have the energy to do both. And I would lay in my bed at night in terrible pain, thoroughly convinced that I had been misdiagnosed, tears soaking my pillow, just praying to God to take me. And every morning, I'd still be here. I really don't think that it's possible to relate to you the loss and suffering my family and I endured in the minutes that I have with you here. But let's just suffice it to say I was bankrupt and unemployable, and my world was becoming very small. So I started operating my life from a very logical standpoint. Things like thinking care should not kill a person. So I started taking holistic and naturopathic approaches in order to rid my body of the toxicity of the medications that I was taking. But eventually I hit a wall, because even though I'd still improved, my health still ruled my days, my nights, and my life. In 2014, new symptoms developed. I began having trouble keeping my balance. I was running into walls, dragging my left foot, couldn't grip with my left hand. It was a concern of my doctor that I might have ALS. But I also realized that I would continue to live a lifetime of surprises if I couldn't find the root cause, or I couldn't find an actual cure for what was going on. I just wanted my life back, and that's all veterans want. We just want our lives back, because no disability check or rating could ever take the place of living a productive, happy, and normal life. I was a co-host on a weekly radio show last year when I heard about hyperbaric oxygen therapy, or HBOT, and the preventable suicide rate among my fellow veterans. And shortly after that, I was introduced to Dr. Carol Henricks in Tucson, Arizona. And since then, I've been on an accelerated path regarding the miracle that is HBOT. Traumatic brain injury among veterans could be cured, and subsequently the suicide rate would be no more. But to learn that this was actual knowledge that the VA had, and all of these suicides could be prevented, not only did that defy logic, it was just plain wrong. My personal experience with HBOT, I had no more night terrors. I had decrease in pain and an increase in energy. Those night terrors, I haven't seen another one since. And because I've had the pleasure of working with Dr. Henricks, I have not only heard of the blessings that are because of HBOT, but I have met the people behind those stories. We live in a day and age where we chase down symptoms with pharmaceuticals. Yet we have to fight on so many fronts to even acknowledge the bona fide, proven miracle of healing that is HBOT. The one thing that has been proven instrumental in giving veterans and countless others suffering from traumatic brain injury and other war-induced trauma their very lives back. The fact that we have to fight so hard to make that common knowledge and a standard of care, now that really does defy logic.
So Robin had, right before she had her episode of collapse, she had the anthrax vaccine, but she also had multiple concussive exposures as well. Hyperbaric oxygen therapy for military veterans is becoming the standard of care. The governor of Oklahoma signed a bill into law in June of 2014. The state of Texas signed a bill into law over Memorial Day of this year. And the U.S. Marine Corps is participating in a study with Dr. Paul Harch, who's the local, he's actually the national expert on hyperbaric oxygen therapy and military veterans. And there's a number of states, including the state of Arizona, where we have initiatives in place to try to establish hyperbaric oxygen therapy through Patriot clinics as the standard of care for military veterans with TBI, PTSD conditions. This is the standard of care in Israel. In Israel, if you have exposure to a concussive blast, they assess you with neuropsych testing, brain MRI, DTI, brain quality SPECT scan. If they determine that you've been injured, you get nutrient optimized, you get cognitive therapy counseling, 60 hyperbaric sessions, and then reassessed, because they value their military and they want to make sure that they are restored. We aren't even recognizing the concussive injury. I wanted to go on, though, and continue to encourage you that hyperbaric is not just, I'm not just saying it's a treatment for concussion injury, it's a very powerful healing therapy for many kinds of brain and spinal cord and nerve injuries, but many other conditions as well. In Russia, there's 76 different medical conditions that hyperbaric oxygen therapy is recognized as the treatment. In China, there's 55. In China, they're actually putting young children with academic and athletic promise into hyperbaric chambers to maximize the development of their abilities. In Japan, if you call 911 and you might have had a heart attack or a stroke, they'll come to your house in a hyperbaric ambulance to minimize the loss of heart and brain tissue. So this is a very powerful therapy that just really is not being used in the United States. I treated a woman who had had a head and neck injury. She'd been assaulted, and she had a cervical spine injury, and she had been in a motorized wheelchair for 20 years. After almost 100 treatments, she was up out of her wheelchair walking normally, and that was in 2008, and she still walks and drives a car and does everything. Now, she doesn't have the fine motor skills that she had before her injury, but she's walking after being in a motorized wheelchair for 20 years, and it's not a fluke, it's true healing. And this person had a cervical spinal cord injury and is showing you his ability to move his legs. Not my patient, though. there is a Dr. Mal Hooper in Australia who's really leading the way worldwide. He's using hyperbaric oxygen therapy, stem cell therapy, electrical stimulation, external robotics, and nutrient therapy, putting all the best things together, and he's doing a tremendous job helping people to heal from their spinal cord injuries, heal and actually recover. Anoxic brain injury is another important topic. A researcher in France actually studied young Frenchmen who had near hanging injuries. And so they hung themselves to the point where they were asphyxiated and had to be resuscitated. And half the group got resuscitated in the hyperbaric chamber within 3 hours, and the other group had no resuscitation with hyperbaric. So the group that had no resuscitation, they all either died or are living out their life in a nursing home, and the group that got hyperbaric, almost all of them left the hospital or required some physical therapy afterwards. So it's a really powerful therapy that we need to look at for, what if we immediately treated all these little children that were near drowning? It seems that hyperbaric oxygen therapy interrupts that cascade of injury and brings them back to a normal or near normal. Our friend and colleague in England, Dr. Philip James, they have a program over there where if a baby has been the product of a prolonged delivery and they think the baby might have had some hypoxia during that delivery, they put them in the hyperbaric chamber, and they've decreased the amount of cerebral palsy diagnosis over there. And what if I was the only neurologist at Tucson Heart Hospital for more than 10 years, so I had to do all the brain death protocols. And it really frustrated me that no one would listen to the idea of, let's try to put these patients in a hyperbaric chamber after we resuscitate them, and maybe we can really fully resuscitate them and help them to recover, because that is what some of the initial research has suggested. And you might have seen the research paper or heard about the research paper written by my colleagues Dr. Paul Harch and Dr. Ted Fogarty. There was a young child, a 2-year-old girl, who had a near drowning episode, and she was quite disabled afterwards. She wasn't put in a hyperbaric chamber immediately, but they did an MRI and it showed extensive brain injury. They did hyperbaric on her. She had great recovery, and you could see the recovery in the MRI of her brain. And that was featured on every news station. About a week and a half ago, it was on every news station around the country and all kinds of media sites. So this is something I think we need to take seriously. This is something we need to do. Over the years, I've been doing this for 14 years. We think that I was the first or one of the first neurologists using hyperbaric oxygen therapy to treat a whole variety of neurologic conditions. But we have treated in our chamber people with Parkinson's diagnosis, Alzheimer's, and ALS with good outcomes. So why would it work for people with those diagnoses? And the important thing is to understand how neurologists make those diagnoses. Those are all clinical diagnoses based on initial clinical presentation, clinical features, and clinical progression. In all those groups of diseases, there's only about 10% of people that seem to have a genetic marker that correlates with that diagnosis. So what makes up the clinical presentation of those disease processes many times are a lot of treatable conditions. anytime you look at somebody's brain MRI of somebody who's 40 or older, you always read deep white matter ischemic changes. Deep white matter ischemic changes means that you're not perfusing the deeper parts of the brain very well. And so there's some injury. So hyperbaric will help that. And nutritional deficiencies, we can treat those. Post-infectious changes, we can help people with that. So there's a whole, when you look at the differential diagnosis in the neurology textbooks for all of these diagnoses, there's all kinds of treatable conditions, and certainly hyperbaric oxygen therapy treats many of those things listed in the differential diagnosis. This is a patient, on the left side you see pre-hyperbaric, you see the one side of the brain is pretty dark. This is a patient who came to me, he was in his 60s, he was 1 year post-stroke. He had had a stroke on most of the anterior 2/3 of his brain. He wasn't speaking when he came to me. He had 100 hyperbaric treatments, and you see on the left side places that are dark on the left side now are white on the right side, which means that they have become metabolically active. And he was speaking, and he was starting to use his right arm, and he continued doing some hyperbaric and therapies and got everything back. The only time you could tell that he had had a big stroke is when he started to get fatigued at the end of the day. His speech would not be as good, but it was a very dramatic clinical presentation with the inability to speak or use his right arm, and he went back to playing softball. And that's just not something you see in somebody that's had a large and devastating stroke. And since this is Doctors for Disaster Preparedness, what I would say is the upcoming disaster is all of these military and all of these athletes and all these people that have had all this exposure to create brain injury, and what is their future going to be? One of the websites estimated that there are 3 million military veterans with PTSD diagnosis. Now, you know what I think of PTSD diagnosis, but there's 3 million veterans estimated to have this kind of injury. And for sports and athletics, there's estimated to be 4 million concussions a year. And of course, there's a lot of sub-concussions or concussions that are not recognized. So where are we going to go if we cannot treat these brain injury conditions? Where are we going to be? And I think an important book that lots of people should read is The Oxygen Revolution, which is the 3rd edition by Dr. Paul Harch. Again, he is local to New Orleans. And he talks about all the different medical conditions that can be treated with hyperbaric oxygen therapy, particularly neurologic conditions. And he is at LSU. He's working with the neurology department there to try to establish protocols for all the different neurologic conditions, so to include pressures, lengths of treatment, maybe some supplements and other therapies that might work together with the hyperbaric to help heal people from all of these neurologic conditions.
Is it as much of a problem after you to separate the non-combat from the combat people?
Well,
Because I know people who do intake for people who claim that they have PTSD and find that there's a very high percentage of individuals who were not combat. They were not in situations where explosions were occurring. They were suffering from PTSD for maybe other reasons. And is that what you see in terms of your practice?
well, certainly it's true that you can have PTSD symptoms from purely emotional causes. But if you really interview your patient, if you really interview that veteran, they're likely to have had other concussion episodes, reasons for concussions in their life before they even got to the military. And certainly, if you go to boot camp, you've fired a gun, and certainly if you've fired a gun, you've been around munitions and heavy metal poisoning. You have the potential to have all of those things. So I think that what we need to do is probably to do a better job of ruling that out, not just to say, oh, you never went to combat. And some of the guys that I've taken care of have had pretty bad episodes happen to them during basic training. So they never were deployed, but they had very bad concussion episodes happen during basic training, or even from things that just happened between other military guys during the basic training, getting beat up or things like that. So I think it's just a matter of getting a really complete history instead of just writing off and say you were never deployed, so you couldn't have this condition.
Is the atmosphere in the chamber the same composition as this atmosphere, or do you add oxygen to increase the oxygen?
So the atmosphere in the chamber is pressurized with external air, but we have oxygen coming in from the hazmat room at the back of our facility. The oxygen comes directly into the mask, so they're getting 100% medical oxygen. So they are being pressurized with 100% medical oxygen during that 1 hour of treatment time.
Did you have MS on the list of other diseases that have...
I did not, but certainly it is on the list, absolutely. And Dr. Philip James in England is the one who has studied hyperbaric oxygen therapy for multiple sclerosis the most. And his conclusion is the earlier you begin treatment and the more consistently you treat, the better your long-term outcome will be.
In the Israeli studies, have they reported some studies so that you can tell with regards to their protocols?
They do have studies. The best place to look for all the studies, because there's too numerous to list, but the treatnow.org website lists all the references and studies.
Did they find changes on the MRIs pre and post-op or post-treatment?
Yeah, they use the MRI DTI and they use a brain quality SPECT scan, but they did not use just a regular bland, MRI to look at it. They used the higher level brain imaging. Yes.
I was writing down that website. How is all this reimbursed? Is it private insurance carry it? And if you're on Medicare?
There is absolutely no reimbursement for any of this. And so, a clinic like mine that's a Patriot clinic is, when the veterans come to treat with me, I used to just treat them for free and I couldn't do it. So veteran service organizations are sponsoring veterans to be treated.
And what would be your guesstimations of how this will evolve, say, with Alzheimer's? In terms of reimbursement, Medicare-wise, ever?
I kind of have nothing to say about that because, my colleagues, Dr. Bill Duncan and Dr. Paul Harch, have made more than 300 presentations to Congress, the military, and the VA. They have the information. They have it. And certainly, and they have also done economic studies to say, well, how would this help us if we treated people and actually healed them? It would save billions of dollars to actually treat people instead of just chronically medicating them and all the disease and disability. And another good point is if somebody has a diabetic foot ulcer and you start to see that skin break down, the red shiny skin, that's when they should go to a chamber. Not that it's going to be reimbursed, but if you care about your foot, that's when you're going to go to an outpatient chamber and start treating so you don't evolve all those series of pathologies and end up with the amputation. By the time they will cover the cost of treating you in a hyperbaric chamber, you have to have had 2 revascularization procedures that fail. That means your foot is almost falling off before they'll put you in the chamber, and even so, they have more than a 50% success rate. But if you start early and treat early, then you're going to be okay.
You did not mention cancer.
I did not, because that is not my area of expertise, but certainly hyperbaric is being used in cancer patients. Like I said, it's a very powerful therapy that's very good for restoring health. And there's a Dr. Dominic D'Agostino who's really coordinating all the research. But certainly, in Arizona, we have a lot more naturopaths, and all of them are referring patients with protocols for hyperbaric to help people fight cancer.
Children can have accidents from the time they're toddling around to any time. They can bump into things. So any child that's been treated by a psychiatrist or a psychologist might benefit from this.
Sure, and Blue Cross Blue Shield did a huge study of childhood concussions and the adverse effects on children's emotion and academic performance later on.
And the other thing is, you should build a huge chamber with a place so you could go in and out without depressurizing it, and you could treat a lot of people. That would bring the cost down possibly.
Well, it would be nice for someone to finance that, and Dr. Jane and I have talked about that, and she had the brilliant idea of using airplanes, abandoned airplanes, because they really are pressurized chambers that could potentially be used.
Fantastic idea. Thank you.
What is the actual pressure that your patients are undergoing? Let's put it that way.
We're putting them at 0.5 atmospheres above the ambient pressure.
Okay, so that's not at sea level, a little bit over 14.7 then, so to speak. Okay.
At 1.5 atmosphere.
Okay. 20 psi. Okay.
That's 2022. Sounds
Yes.
closer to right.
The second question is for the spinal thing. That was kind of interesting to me. The spinal cord injuries or whatever. What is the mechanism that actually the extra oxygen does for these spinal injuries that invokes healing? That's the second.
Okay. So if you think about a cervical spinal cord injury,
Yes.
remember that the motor neuron starts here in the motor cortex at the back of the frontal lobe, comes down through the brain, crosses over in the brain stem, comes down to the cervical spinal cord, and connects with secondary motor neurons that control the arm. But then, of course, some of them travel all the way down to your lower back before they connect to the secondary motor neurons in your lower back. So it heals from the brain. The healing starts from the brain cell itself, which is up in your frontal motor cortex. So the healing process starts here. It hasn't been injured here. It's been injured down here. So you make this cell healthy and you support its ability to heal the lower down part of the cervical spinal cord. Certainly, in Australia, Dr. Mal Hooper works with people that do stem cell transplants and inject it around the injured area. There's things like pulsed electromagnetic field, which help to energize local healing. Nutrient optimization, near-infrared light, they put it all together. I mean...
Okay, thank you. Right.
Okay. And certainly, if you go to my website and go to the slideshow, it has all the contact information for me if you would like to ask me questions later that you think of after the talk.
I'm intensely interested in this. I'm 80 now, but a year and a half ago I had a ischemic stroke in the brainstem area, and I was lucky to get to the emergency room in 15 minutes. And that made all the difference. I have a slight imbalance, and I've been accused of being drunk when I'm never drunk. And I just wondered, what did I wonder? Let's see, how to get my memory back. No, joking. I wonder if you have treated ischemic strokes with success in the elderly.
Absolutely. Absolutely. And Israel is now treating people that are 20 years post-stroke because it is still a helpful treatment. The interesting thing about the brain and brain cells, I mean, our brain is meant to learn and save memories and develop all throughout our life. There's no end point. You know, that's one of the beautiful things about plasticity. We're beautifully and wonderfully made, and there's no limit on our brain. There's not a stopping point.
Encouraging.
Don't use abandoned airplanes, use operational airplanes. They aren't flying all the time.
Okay.
How much does an individual treatment cost if you're not reimbursed by insurance?
So it depends on what part of the country you go to, but probably an average around the country is $150. For an hour, yeah. The cost in a hospital setting, you know, the bill that can be sent to the insurance company when they do it in a hospital setting for like a diabetic foot ulcer can be $1,500 to $2,500 for that treatment. But at the outpatient treatment centers, you know, our network of centers around the country, I would say $150 is a good average. And you do need to be evaluated by a physician before you go in the chamber. Most people, like my center, prorate, so 100 treatments at my center would be $10,000. But, you know, most people need much less than that. But of course, if you have a more serious situation, you need more.
Are there are a lot of Patriot clinics around the country?
The best place to look is treatnow.org. Because that has a list of all the Patriot clinics, but the Patriot clinics are also the available outpatient clinics that are willing to treat off-label. Hyperbaric oxygen therapy is not experimental, it is off-label.